Hello, welcome to this CPD session on lifestyle medicine for menopause. My name is Justine Bold and I'm the Programme Director for CPD in the Postgraduate Department of the Centre for Medical Education, and that's in the medical school at Cardiff University. I'm working on CPD courses and have an interest in interdisciplinary learning where health professions and medics, nurses and allied health professionals learn together. My background is as an academic lecturer in nutrition, and I've worked at another university as a lecturer on a master's programme for over 13 years. I have research interests in female reproductive health, but also mental health and the way that malnutrition might influence on or influence health and disease. And I have an interest in gluten and celiac disease. So that's a background to me. You can find me on Twitter and Instagram, and I will be doing a questions and answers session for this session on Twitter. So in terms of my publications on female health, they've been sort of focused around reproduction. That gives me an interest in all things hormonal. And I have published more on fertility and infertility, but I am interested in lifestyle medicine, so things like exercise, weight management, but also the evidence base for complementary and alternative therapies and for lifestyle interventions that include diet. So I've published on that in a book on infertility and recurrent miscarriage that came out in 2015, I think, and then also a journal article that was published in 2017. So what we're going to cover today is we're going to have I'm going to briefly introduce what lifestyle medicine is, and then I'm going to have a look at that in menopause with a view to either, if you're a health professional, giving you a view to strength of evidence that you can encourage people to use for sort of self-care strategies, or if you're watching this because you're interested in your own health, that you can employ yourself. And obviously on the Twitter, we're going to do, I think it's on the 22nd of April, I think that's right. It's a Thursday anyway, we're going to do questions and answers. So if you've got any questions, so you can tweet them in. It doesn't have to be, you can tweet them in advance to the CPD Twitter address, which I've got at the end. So there's a British Society for Lifestyle Medicine has been established for some years now. And what they are trying to do is get, particularly I think primary care doctors to think about the patients that they see and to think about them as a whole person, and that includes not just their health conditions, but also their lifestyle. So it's thinking around physical activity and exercise, diet and nutrition, how well somebody sleeps, but also things like stress and their mental well-being, and things that can be damaging for health, like substance issues, tobacco, drugs and alcohol use, and also to think about them in the context of their relationships with other people, so family and romantic relationships, how they actually live. So in menopause, lifestyle medicine, it has some things to offer, and I think it's interesting, and sort of we've got to think about what your view of menopause is, perhaps. For some, menopause is a state of hormonal insufficiency. It marks the transition from being able to reproduce to being, reaching the end of reproductive age. So it's normally obviously marked by the last menstrual period and 12 months without menstruation. But, it can just be viewed as a natural part of the female sort of aging process and life cycle. So, I think we've got to think about how we kind of view that. In women, it's usually occurring sort of mid-40s to mid-50s. Although the age that it occurs sort of varies, throughout the world, and it's dictated by things like genetics, but also nutritional status. So there is some evidence that in some countries it occurs earlier than in other countries. So in India, it occurs at around 44.5, and in France, it's happening around 52 years of age. It is important to remember that it can happen early, and when it happens earlier than normal, that can be called premature ovarian failure. So it can actually happen to a woman in late teens or in early 20s. So ovarian age doesn't always correspond to chronological age, because there are circumstances where, you know, a woman who is young may have ovarian failure and have entered menopause early, whereas a woman in her 40s could potentially, you know, in her early 40s could still conceive. So with menopause, we see changing levels of hormones, and it's effectively the cessation of ovarian production of estrogen and progesterone. And what happens is, to compensate, the pituitary gland in the brain increases. In early menopause, it starts to increase the amount of follicle stimulating hormone and luteinizing hormone. These are the main hormones that control the menstrual cycle in women. It's trying to get the ovaries to still release some hormones. So what we can see is elevations of follicle stimulating hormone and luteinizing hormone as a woman enters menopause. And menopause can be confirmed by an elevation of those two hormones, though I don't believe testing is recommended in the UK to define menopause. So it is known that women who have more body fat have a more comfortable menopause, because of the ability of the fat cells to produce some estrogen. And obviously the adrenal glands, which sit on top of the kidneys, can actually make some steroid hormones, and they can become a source of estrogen after the menopause. So that's important sort of background considerations. So the main signs and symptoms of menopause, I'm sure we're all quite familiar with, but it includes hot flashes, sorry, I should say hot flashes there, and insomnia, irritability, depression, can affect cognition, so it can affect memory. Women can get increasing pain, joint pains, arthritis problems can flare up. There can be obviously low libido, and there can be vaginal dryness and atrophy. So what we know about menopause in the brain, it's interesting. I actually wanted to find the mechanisms, and I found this paper. It is quite old, but it did explain the mechanisms. So estrogen receptors are found widely in the brain. So as estrogen levels decline, it can actually affect cognition and mood. So it is quite common for some women to develop sort of anxiety or depression around menopause as well. There is thought to be a period before menopause called perimenopause, and this might start where a woman has perhaps irregular periods or heavy bleeding, and it can have a duration of around 3 or 4 years. So there's an article there. It's a bit greyed out, I'm afraid, but it's from Harvard Medical School there. I think it's the medical school. So I've mentioned premature menopause, sometimes called premature ovarian failure. This is defined as menopause before the age of 40, and it does affect around 1% of women. And often there's no cause, although there can be genetic causes. There's also a condition called galactosemia, which can cause premature ovarian failure. And HRT, that's hormone replacement therapy, is recommended until the natural age of menopause, obviously because of its estrogen's protective effect on bone mineral density particularly. So HRT is obviously used in medical management of both premature ovarian failure and menopause, and there are options for administration ranging from oral to transdermal routes, and NICE have some guidelines on the benefits and risks associated with HRT, because it is known that there's some risks associated with it. But it obviously depends on age of administration and the type of drug used. So if you're interested in that, you can look that up via the NICE pathways. So in terms of lifestyle medicine, Quite a lot of what's out in the public domain has come from the work of Dr. Chatterjee, because he's published the 4-pillar plan, which talks about some of the foundation pillars in lifestyle medicine around eating well, sleeping well, relaxing and movement. So it's around exercise. So in terms of foundations for particularly female health, if we think in those contexts, we'd be thinking around eating 3 regular meals, having 5 a day fruits and veg, also having healthy fats, so lots of the omegas, having lots of colours in our diet, so rainbow diet particularly. A lot of those phytochemicals are very useful. Sorry, my computer's now opening Flash when I don't want it to. Having treats and alcohol in moderation, and including phytoestrogens, also whole grains and healthy protein sources. It is obviously around supporting sleep, which we know can be disturbed with hot flashes. So sleep hygiene can help us here around having regular bedtimes, regular bedtime routine, perhaps having a hot bath before we go to sleep to relax, limiting screen time, or perhaps using Blu-ray glasses if you're watching screens in terms of iPads or phones or laptops late in the evening. Having bedroom that isn't too hot, because a hot bedroom can help obviously make us worse if we're having hot flashes, and avoiding maybe caffeine in the evenings or excessive alcohol in the evenings. And in terms of daytime relaxation, it's around being in nature, maybe time with pets, being creative, journaling, enjoying music, time with friends and family. Obviously, that's COVID permitting. We've all probably been a bit starved of that over the last year. And in terms of movement, it's having active daily living, walking, forms of exercise. I've looked at yoga in the context of this presentation and the evidence on menopause specifically, but I think there's benefits for other forms of exercise as well. So that's our foundation pillars. What I'm going to try and do now is show you some of the evidence. So I'm going to start with eating. That's obviously what I know most about because of my background as a nutrition lecturer. If we were working with a patient or client, or even thinking about our own, intake, we think about, how have I eaten over the last 10 years? Have I been vegetarian or vegan for a long time? What are my food preferences? What foods do I like? What are my signs and symptoms? Have I got more of the mood and anxiety symptoms, or I got the vasomotor symptoms, so the hot flashes, or have I got more of the joint pains? Do I have any obvious nutrition gaps? If I've been vegetarian for 10 years, 20 years, what do I think my status is of things like vitamin D, which can be low in vegetarian diets? And how does my assessment of my client's diet or my patient's diet or my own diet, how do I think about that, given what I'm going to learn next about some of the evidence? Do vitamin and mineral supplements make any difference at all? Or can they? So the British Nutrition Foundation in the UK publishes guidance on menopause, and you can find that there. It does major on healthy eating for weight management and bone and cardiovascular health. So that's what it's. I've put the beginnings of the advice on the next sheet or slide. So it's talking around, making sure you get the dietary recommendation for calcium, which is 700 milligrams a day in the UK. It talks about important sources of calcium and also important sources of vitamin D. It is saying that you can have dairy alternatives if they're fortified and you don't eat dairy. It's also saying to include some seeds and maybe dried fruits as sources of calcium, and maybe small fish like sardines with the bones mashed in as well. So it doesn't say so much about managing symptoms and menopausal symptoms. So that's what I'm trying to do for you next. I had a look at papers looking at sort of nutritional dietary intake patterns, and a lot of these are obviously retrospective studies, or some maybe prospective, but it's what do we know about women's diet and menopause, and maybe the age at which it happens, or the severity of symptoms. And I found this study, and it was interesting. It was published in the BMJ in 2018, and it basically says that a dietary intake of oily fish, that's a really rich source of omega-3 healthy fats, and vitamin B6, and also fresh legumes. They are a source. That's things like pulses, so lentils, peas, split peas. They are actually phytoestrogens, but they're associated with later menopause. So that's quite interesting. And some you do see in the media quite a lot of articles advocating phytoestrogens in management of menopausal symptoms, and actually you can see them in being advocated for, in managing menstrual symptoms as well. And the mechanisms, obviously there are lots of different phytoestrogens, that's the first thing to say, and the mechanisms of action for them are complex because they can be both agonist and antagonist to the steroid receptors. So they can enhance, and they can effectively be a weak estrogen for the body, but they can also block maybe endogenous estrogens as well, which is how they can be beneficial in managing PMS symptoms. So there are lots of different classes of compounds, and they include lignans, isoflavones, and then there's some other ones listed here as well. So I've actually tried to break down some of this information later, and I've looked at some of the herbal medicines with estrogenic effects and tried to look at the mechanisms of action there. So isoflavones, obviously that's one of the main compounds. They're found mostly in soybean foods. Obviously, I'm thinking about food sources here. And the phytoestrogen, the isoflavones that you can find in soybean include, there's 3 different types there. And actually there may be a role for gut bacteria in transforming some of the substances. So they biotransform the plant polysaccharides to release the lignases and isoflavones. So we do get in some of the studies variability of effects, and it might in part be explained by the differences in microbiome in some women. I've got a paper on that later, but I had a look for higher levels of evidence on isoflavones, and I found a systematic review from 2019. Now it actually says isoflavones do reduce hot flashes. They can also have beneficial effects in terms of attenuating bone mineral density loss from the lumbar spine, and they have beneficial effects in terms of systolic blood pressure in early menopause. But there's no benefit in terms, or no conclusive benefits in terms of the urogenital symptoms or cognition. So this is another paper. It says isoflavones, this is actually from 2019, and it says isoflavones benefit some but not all postmenopausal women. And actually it's whether women can make a substance called equal from the isoflavones that may be explaining that variability. I tried to dig a little bit deeper, and I found that actually it's the gut bacteria, it's a metabolite of isoflavones produced by the gut bacteria. And actually what we know, there's lots of emerging research on microbiome in human health, really interesting area. We don't yet really know what a healthy microbiome is. We know that diversity of the microbiome is really important, but it seems to have a really important role in managing inflammation, but also here in terms of metabolizing some of the things to give us beneficial effects in terms of the phytoestrogens. So if we're thinking about food and diet and what people can do in terms of lifestyle, well, where are they found? Well, they're found in legumes. I've mentioned those already. So that's things like the split peas, pulses, lentils, but also soybeans and chickpeas, faba beans. You can find those in dips, pistachio nuts, also peanuts. But obviously soybeans are the richest source. So other sources of phytoestrogens include wheat, cucumber, carrots, potatoes, things like alfalfa and oats, flax seeds as well. You can also find it in rye and sesame. So here I started to think about what level of intake do people need to actually get. And I found a study actually saying that the isoflavones didn't impact on mood, and that actually supports the results of the first study that I presented, the meta-analysis, which said that the isoflavones had an effect on the vasomotor symptoms, but not on cognition or the urogenital symptoms. But this was interesting because it actually included some information on dosage. So here they'd studied 10 milligrams, 35 milligrams and 60 milligrams, and defined 10 milligrams as a low intake, medium intake at 35 and high intake at 60 milligrams. So I had a look for other studies, and this is looking at 6 grams of soy germ, 25 grams of soy protein and soy nuts, and then they've got isoflavone powder 90 milligrams, and they've got red clover at 80 milligrams here. And then they've actually looked at supplementing equal at 30 milligrams a day. So I thought that was quite interesting, because some of you may be drawn to have a look at some of the supplements that are on the market. So let's talk now about sleep. Sleep can be disturbed, and when sleep is disturbed, it has a knock-on effect on health, and we know it's associated with increased risk in cardiovascular disease, but also things like apnea as well. And obviously it can affect mood, depression can be associated with insomnia. It's quite interesting that premenopausal women, there's some evidence that they sleep better than men. So there might be a role for estrogen in promoting good sleep. So sleep hygiene. I mentioned earlier the importance of having regular bedtime routine, but it can really help because it can help prepare the body and the mind for sleep. Allowing wind down time, thinking about Blu-ray exposure, maybe not having a bedroom TV, maybe having nighttime herbal teas, perhaps looking at the over-counter remedies, seeking advice from a pharmacist, maybe seeing GP if problems continue. In terms of nutritional support, we would say avoid caffeine, afternoon caffeine, evening caffeine, and maybe try to, sorry, I've got children running through to the garden, running through my study, and also cockerels in the garden. So I apologise for background noise there. But we would also say maybe to increase foods that contain the amino acid tryptophan, because that can get converted through to, so it's needed for serotonin synthesis. So foods that are rich sources of tryptophan include poultry, oats, eggs and bananas. So sometimes a banana before, but in the evening, maybe a banana as part of your pudding at supper time. We would also recommend the magnesium-rich foods. And magnesium is a component of chlorophyll, so it's found in green veggies, also very rich in whole grains and nuts. And magnesium, in stress, the urinary excretion of magnesium is increased. So we see nighttime waking as being associated with low magnesium in the body, and maybe people not hitting magnesium requirements. And I'm actually presenting also on pain in menstruation, and I've got a paper in that presentation which actually says that around 2/3 of the Western world doesn't hit nutritional requirements for magnesium. So it's one of those things that we can kind of safely up the levels of. Obviously, if you're on any medication, you need to talk to a pharmacist or qualified nutritionist, nutritional therapist to check drug-nutrient interactions. But magnesium salts can be added to the bath. They're sometimes called Epsom salts, and they can be very relaxing as well. And you do get a little bit of transdermal magnesium absorption, and it can help ease muscular tension. So that can be a nice nighttime addition for people in terms of self-care. We would also say for people to go outside and to get daylight exposure, because this can be very important in terms of regulating the waking and sleep cycle that we call the circadian rhythm. So that day, that 24-hour cycle of sleep and wake. So particularly early daylight exposure is important for that. So if people aren't going outside, they're staying inside all day, they're not looking outside their windows, then that can obviously exacerbate the situation. So one of the benefits of going outside, one of the other benefits, and it's particularly important for menopausal and postmenopausal women, is that we can, through the action of sunlight on the skin, make vitamin D. And around a third of adults might be deficient in vitamin D in the UK. If we wear sunscreen, we won't make it because the sunscreen will block the conversion. But if you can safely go outside without burning for 10 to 15 minutes a day, that will help you make some vitamin D. And vitamin D is really important for menopausal and postmenopausal women because it helps us to regulate calcium absorption. So that has a direct link into bone health. So if we're thinking around calcium absorption, let's also think about food sources. I think everybody knows that dairy and dairy foods like cheese, yogurt are rich sources of calcium. You can see there's one, in a cup of cheddar, that's around 132 grams of cheddar cheese, will give you over 900 milligrams of calcium there. But if you don't eat dairy foods, then the fortified plant-based milks can be a good source. Here on the nutrition database that I used, which is American, I could only find Starbucks soya milk. So they gave me the amount in a Starbucks tall drink of 420 milligrams. So you can also see that if it's fortified, it's a rich source. But if you're vegan, then you have to work a bit harder. You have to maybe have those fortified soy plant-based milks as well, but also think about eating green veggies, the cruciferous veg particularly high in it, so kale, broccoli. Also things like tahini, that's the mashed sesame seeds. It's used sometimes in hummus. They can be rich sources as well. We want you to get at least your 700 milligrams a day. So I'm going to have a look now at some of the herbs and botanicals, particularly because they can be also phytoestrogens. So I found this 2017 review. So if you're a healthcare professional or a medic, you might want to have a look at this. It's an open access paper, so you can have a look at it. So what they did here is they listed the mechanisms of action by which some of the herbs, or some of them are herbs and used in herbal medicine, but they can be food components, things like fennel is a food component as well that you can eat. Obviously sage can be eaten, can be taken medicinally as a herb, or in capsule or oil or tincture form as well. So you may obviously want to, if you are thinking about yourself, consult with a medical herbalist or somebody like a nutritional therapist who can recommend herbal. Somebody who is a herbal medicine practitioner might make their own tinctures, whereas somebody who's a nutritional therapist will be able to recommend pre-packaged formulations. That's the difference there, really. But they'd be able to make a recommendation that was maybe right for you. So you may want to consult on that. But if you're interested in the studies and how they work and the mechanisms of action, you can have a look at those there and pull that paper. It does go into the details in terms of the mechanisms of action. Some of them are estrogenic, and sometimes it's working, at a different level. Perhaps I was having a look at the GABA. They're actually saying that, oh, maybe that's valerian. Actually, that's a herb. You can also find that in some nighttime teas. That's the third one down here on the page. It's increasing levels of GABA in the synaptic cleft. That's a neurotransmitter, so that's how that is actually working. So if you're interested in the mechanisms of action, pull that paper, have a look. But there is evidence, and it may be that in early stages of menopause, if a woman doesn't want to maybe go the full HRT route, that these interventions can give some symptomatic benefits. So I found a much earlier review that actually concluded that there is evidence in terms of both vitamin K, calcium and vitamin D, and weight-bearing exercise in terms of preventing bone mineral density loss and also lowering the incidence of fractures. But also here it actually says that black cohosh is effective for relieving menopausal symptoms, and principally the hot flashes in early menopause. And phytoestrogens have minimal effect on hot flashes, but they do have other positive health effects in terms of the lipid profiles and bone loss that we've had a look at earlier in the earlier papers that I've presented. So there's 2 review papers there, one more recent from 2017, obviously one a bit later from 2010, with sort of similar studies. Finally, I had a look at yoga. Exercise is beneficial. We obviously know that in terms of bone mineral density, but here this is a 2017 systematic review with meta-analysis that actually says it's beneficial in terms of managing menopausal symptoms, but that yoga's benefits were similar to other forms of exercise. So I thought that was interesting as well. So I'm going to summarize now. I hope I've given you a flavour for what can be done with lifestyle approaches. What we would say really is to use whole grains, nuts and soya products in the diet. Soya products obviously include things like miso soup. Miso is particularly beneficial because it's made of fermented soy. Maybe think about consulting a herbal medicine practitioner if symptoms are very troublesome and somebody doesn't want to go the full HRT route, and maybe before they consult with doctor about that, including healthy fats in the diet, so the omega-3 fats, getting 5 a day. That's in terms of fruits and veg, and lots of colours, so a rainbow diet, including foods that are really good for gut health, so things like live yogurt, sauerkraut, kefir, and having alcohol and caffeine in moderation, including those beneficial herbal teas, maintaining healthy weight, and obviously consulting with GP if symptoms become more problematic and unmanageable. So that's a view to self-care tips. Sorry, I don't know why that was out of order, obviously including exercise and enjoying time outside. So in the PMS presentation, I've put in the Eat Well plate that the NHS uses, and I've also put in an American plate from Harvard. But in this presentation, I've actually put in the BANT, which is the British Association of Nutrition and Lifestyle Medicine plate. It's sort of maybe a bit more aspirational because it's maybe trying to up the fruit and veg intake from 5 a day to 7 a day. And it also says to include a rainbow diet. But I feel that this one's particularly beneficial for menopause, so I've put that one in here. It's quite a useful guide and reference. So I hope I've given you an outline, a taste really, for how some lifestyle approaches can support women, and to give you an overview for some of the evidence and strengths of evidence. Obviously this is a short session, so I can't go into lots of detail, and I will be answering questions on Twitter at 2 p.m. on the 22nd. I did get the right date earlier, and you could message in advance if you want to the Cardiff Uni CPD Twitter account. You could copy in my own Twitter account as well. So thank you very much for listening to me.